Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we're going to talk about Lyme disease. I look forward to seeing the questions you have tonight because your questions create the webinar, and no 2 weeks are ever the same. Sometimes we get into themes of the night, so I'm interested to see if there's a set of questions that seem to repeat themselves or common themes. So we'll see what you have in store. For those of you that are new here, welcome. And for those of you that are back again, I see a number of familiar names on my board. I'm glad to see you keep getting value and you keep returning. And I hope we can deliver more value for you and that you get something out of the webinar tonight that can help your Lyme disease or mold toxicity or the various problems that I can give recommendations about here. For those of you that have not participated in these webinars before, there's two ways you can participate. Number one, you can listen to the questions and the answers that I give. And in fact, if you're participating in the live version, I actually post the questions on your screen so you can see them as I read them. And the reason I read them is so people in the recorded version can actually see them. The second way that you can participate is actually write a question to me. To do that, I ask down in the chat box area, click on the question mark that you see down there. Don't leave it as a regular chat, but click on the question mark icon first, then write your question to me. That is the only way that I'm going to respond to these questions tonight. So people that have been writing these as regular chats, I'm not responding to those anymore, okay? I'm only responding to the ones that you write by clicking on that question mark icon, okay? All right. So without any, one last business keeping thing. I am keeping a recording of tonight's webinar, and if everything goes as planned, in other words, if the recording works, I will get a copy of that out to you in the morning, usually before about 9 or 9:30 a.m. I try to get that done. I do write a synopsis or a summary of what we talked about, so you have that as a guide for what would be in the webinar as you listen to it, okay? All right. All right, so without any further ado, let's go ahead and get started here. All right, first question is from Gail. Actually, it looks like it's two questions from Gail. Let's see here. When patients first start Rifampin, if they want to slowly build up to the therapeutic required dose, how slowly do you let them titrate up? And can you give an example of what that might look like? For example, one pill once per day for a week, then one pill twice per day for a week, etc. My Lyme literate naturopathic doctor wants me to take 300 milligrams 2 times a day, but it is so staunch that I cannot titrate up and have to take the full dose right away. All right, let me answer that first question. So I look at the person. So if I've got a patient that has a strong history of having Herxheimer reactions, when I change antibiotics or start a new antibiotic, I am inclined to start more slowly. If I've got a patient that has a history of using antibiotics that never herxes, I might start more quickly. So for a person that never herxes on this drug called Rifampin, I would begin at 300 milligrams, 2 pills, 1 time a day. You can actually dose it as 1 time a day. It's easier than taking it twice a day, okay? But if I've got somebody that's really sensitive, I might have them start at 300 milligrams 1 time a day for 1 to 2 weeks. And I tell them that they can then go increase to 2 pills a day after any herxing they're having has stopped, okay? That tends to be the way that I do that, okay? All right, number 2, I wrote in last week about my thyroid and endocrinologist. Even though my TSH has gone down quite a bit, she feels that my hypothyroid state is from massive hormonal shifts as I move into menopause. However, I take 12.5 micrograms of Synthroid daily, and she said the drop in TSH can't be for the Synthroid as it is just way too low of a dose to make any difference at all. Do you agree 12.5 microgram Synthroid is too low a dose to have impact on the thyroid and the TSH levels? On the surface, no, I don't agree with that. I have had patients that are in very low doses of Synthroid, which is Synthroid is pharmaceutical T4 thyroid. Your thyroid makes both T3 and T4. TSH, everyone, is the chemical made by your brain that talks to the thyroid and says, make thyroid, all right? So if your brain thinks you don't have enough thyroid, you're going to have a high TSH, okay? So high TSH means low thyroid being made down here, all right? And so the way you follow somebody to see if you're giving them enough thyroid is you watch for drops in the TSH. And that dose, 12.5 micrograms, which is a low dose of Synthroid, can produce drops in your TSH. So I'm not quite sure what your endocrinologist is talking about there. Okay, all right. Good luck to you, Gail. Hello, David. Hi, Dr. Ross. My wife had a breakthrough COVID infection and ended up with clots in her lungs and legs. She was in the hospital for a few days. Can the clots reactivate the Babesia? Also, when is it safe for my wife to fly on a plane and take hours-long car rides? We are getting conflicting answers. I have not had somebody that I've had to manage DVTs or deep vein thrombosis, which is what your wife has, for years. And I frankly, I'm not sure what the current standard is for how long it is before you can ride again. So sorry, I'm not going to be able to answer that one. I'd have to research it and probably talk to some of the experts myself if you were a patient of mine. Okay. In terms of the Babesia and blood clots and reactivating Babesia, I haven't seen any relationship in the history of people that I have had that have developed DVTs or developed blood clots. I haven't seen Babesia reactivate by doing that. I mean, I think it's an interesting question, but I think the risk would be actually quite low of that happening. Okay. All right. Thanks for the question, David. Good luck. And I hope your wife does well. Hello, Digger. Let's see. Hello, Dr. Ross. Can chronic Lyme be treated with only one antibiotic every day, 1,000 milligrams cefuroxime, and 2 herbal medicines like cat's claw and Japanese knotweed? Minocycline and flagyl have too many side effects, so I can't use them. Thank you. All right. So the answer is it could. So the cat's claw and the Japanese knotweed are shown in laboratory experiments to both treat the spirochete form of the Lyme germ and also to treat what is known as persister Lyme, which is the hibernating state of Lyme. Okay. Now, Lyme also has a cyst form of the germ, and I assume it treats the cyst form. And I also assume cat's claw and Japanese knotweed treat Lyme that lives inside of cells as well too, because although there's no research that says it does, but because people get better when I use just Japanese knotweed and cat's claw. Okay, so those two herbs together could be a full germ treatment for Lyme. In other words, they treat growing as well as hibernating persister. In addition, they do treat spirochete outside of cells, and they may treat the form of Lyme that lives inside cells and cysts based on the improvements that I see that people get, okay? The cefuroxime that you're talking about only treats Lyme that lives outside of cells, and it only treats the form of Lyme that is spirochete, the corkscrew-looking type of Lyme. And although it may help your treatment, probably the thing that's going to be doing more of your comprehensive part of the treatment would be the cat's claw and the knotweed, because they pick up both growth states and they pick up the spirochete and the cyst form, the way the germ looks, and they also treat Lyme that lives inside of cells, versus cefuroxime is very limited to treating growing spirochetes only, okay? It misses all that other stuff, all right? Okay. Good luck to you. Hello, Andrea. Let's see. Hi, Dr. Ross. I have Lyme, Babesia, and Bartonella. What infection should be treated first? Also, if I'm taking rifampin azithromycin for BART, and that also kills Lyme and Babesia, also, is it okay to break open a rifampin pill and start at 150 milligrams a day if you have a history of herxing? All right. So generally what I do in my practice is if somebody's got Lyme, Bartonella, and Babesia, I tend to treat for Lyme and Bartonella first, and those two together at the same time before I start turning my attention to the Babesia. That's the way I do it in most people. And the reason I do it that way in most people is it was an observation of a physician that helped train a lot of us that manage Lyme, a guy named Dr. Burrascano, who's like one of the pioneers of treating chronic Lyme. He's not practicing now, but he still is heavily involved and still involved in teaching a lot of us. Burrascano's observation in his practice on Long Island is that in people that he started treating Babesia before he had some control on the Bartonella, that it would be hard to get rid of the Bartonella. Okay, so that generally is what my approach is. Treat Lyme, Bartonella first. As the Bartonella symptoms start getting better over a couple months, then I might add in an agent that is better for treating Babesia while I keep treating Bartonella and Lyme. Okay, all right. Now, I break that rule sometimes. So if I've got somebody that sees me and they have Lyme, Babesia, and Bartonella, but it's clear from taking their history that most of their symptoms are related to Babesia and the Babesia is raging, I may start with the Babesia and Lyme first. All right. So I kind of make a decision with the patient at a first visit if I can determine, what's giving the greatest problems in a sense. All right. Now, in terms of the rifampin azithromycin, that is a treatment that is both a Lyme and a Bartonella treatment. The azithromycin can be helpful for Babesia, but it's not enough to get rid of it. Okay. And so, after you're stable on this for a bit and your Bartonella symptoms are starting to get better, then you might add an agent that can also pick up the Babesia. And in terms of opening up the rifampin pills, I will do that sometimes if a patient is having strong herxes. So rifampin has a 300 milligram capsule. You can also get it as a 150 milligram capsule too. It does come that way. But as an alternative, you could open the capsule up and put it in a little liquid and then drink it down that way too. Okay? All right. Thanks for your question, Andrea. Good luck to you. Oh, in terms of trying to figure out which germ is giving you the most problem, you got to do that based on the symptoms of the germ. Okay? So let me just do a quick screen share here for you. All right. So this is my information website, Treat Lyme by Marty Ross MD. And take a look at, if you want to know what the symptoms of Babesia are that you would follow and the symptoms of Bartonella are that you would follow, look in this section here called How to Diagnose. And in this article called How to Diagnose Bartonella, I list out the major symptoms that you would have with Bartonella and what you should follow, okay? Same with Babesia. How to diagnose Babesia, I list out the key symptoms that a person would have with Babesia, and you would follow those and see if they're starting to get better as you treat, okay? All right. Thanks for that question, Andrea. Good luck to you. Hello, Megan. Let's see. Thank you for being the best Lyme doc ever for doing these webinars. I appreciate that, Megan. Thank you. It's so generous of you. Let's see. Question. I got fully vaccinated with my second shot completed in mid-September. I felt totally fine for 2 months. Then starting mid-November, my Lyme symptoms of tendon and joint pain out of nowhere became severe. Nothing changed in my regimen. The severity continues today, months later, but now also includes whole body pain, simply everywhere, and everything hurting. I cannot seem to get inflammation under control. Do you think that when my body was exposed to the spike protein, it suppressed my immune system or kicked up my mast cells? I just can't think of why this is worsening developed because I feel so badly right now. I'm hesitant to get the booster. Thanks again. All right. So Megan, I can't tell from what you've written here as to whether you're still treating for Lyme with antimicrobials. So if you're doing worse with all these symptoms that began 2 weeks later, there's a number of possibilities. Number one, if you've been treated for Lyme with antibiotics and are off of them, or even if you're on them, there is a risk that you could have developed too many yeast in your intestines from all those antibiotics far ago. And those yeast can trigger you to get more inflamed throughout your body. Right? So when you have Lyme, the main reason you feel bad is that your white blood cells overproduce a group of chemicals called cytokines. And cytokines are good and bad. On the good side, cytokines turn your immune system on, cause your body to make more white blood cells and bring those white blood cells to where the infection is. Okay, so that's really good. But if the immune system doesn't do a good job getting rid of a germ, it tries harder and harder and eventually makes too many cytokines. And too many cytokines make it so you can't sleep, give you brain fog, make you hurt all over, cause fatigue, interfere with how your hormonal systems work. Okay, basically, too many cytokines are the cause of your Lyme symptoms. Okay, now other things that can trigger cytokines would be the COVID vaccine. And most people acutely, as they get the vaccine within a day, that response to the vaccine, the white blood cells, the body will make cytokines to turn the immune system on. Okay, usually those cytokines will go away. There is a possibility that after you get the COVID vaccine and your cells start producing these spike proteins, that in some people, the spike proteins get lodged in your white blood cells, and those white blood cells stay turned on for a while and produce excess cytokines. It's possible that's what's happening with you here. I don't know it is happening with you here or not, but that's possible. Okay. Over time, that should get better if that is what's happening. But the other thing that can happen is if you were on antibiotics or are on antibiotics, you're set up to get too many yeast in your intestines. And when you get too many yeast in your intestines, your immune system responds by manufacturing more cytokines. Okay. And so those cytokines can give you a lot of body pain, fatigue, sleep disturbances, etc. So one of the first things, if you were sitting here in front of me, what I'd be trying to pursue with you is to try to figure out, do you have increased yeast? All right. So I'd be looking at any increased sugar cravings, any intestinal gasiness or bloating. Did you have a bunch of sugar before you got worse and suddenly that set everything off? If you have sugar, do you feel worse for it? And then finally, if you get too many yeast in the intestines, they can also release toxins that interact with your skin. And those toxins can lead to more pimples, acne, eczema, skin rashes. All right. So I'd be looking at all those symptoms and see, does it look like you could have yeast? Okay. In terms of controlling cytokines, and this is if this is due to your white blood cells still trying to get rid of spike protein, for instance, the things you do to control cytokines for herxing and for Lyme are the same things you would do here or for yeast. All right. So lower cytokines by taking curcumin. Curcumin is a antioxidant that is a component of the Indian seasoning turmeric. It can lower inflammation production of cytokines by your white blood cells. The product I like for that is a product by Thorne called Mariva 500. It's a liposomal curcumin. Because it's liposomal, it means it's microscopically wrapped in fat, which increases your body's ability to absorb the curcumin. And you would do 500 milligrams or one pill 3 times a day. If you're still having significant pain and you're doing that, then increase to 2 pills 3 times a day. All right. The other thing I would do is be on a really strong antioxidant that can sometimes limit these cytokine surges and cytokine symptoms, and that is the glutathione. Glutathione is a very powerful antioxidant that is made in every one of our cells, and it lowers signals that go to your white blood cells that tell them to make cytokines. So it lowers oxidation agents signaling white blood cells to make cytokines. And the product I like for that is a liposomal product of that too. The reason liposomal is a good idea is it also increases the absorption of your glutathione. and the product that's got a lot of good data and science behind it showing that you really do get elevated levels of glutathione in your cells is a product by Research Nutritionals called Trifortify. You would do 1 teaspoon 1 time a day of that. Okay. All right. All right, Megan, good luck to you. Thanks for that question. Oh, Megan, the type of white blood cells that some people are theorizing that the spike proteins get trapped in for a while are monocytes. It's a type of white blood cell called a monocyte, okay? Right. Hello, Jim. Hi, Dr. Ross. Thanks for these great webinars. I'm having issues with irritation when I urinate. It seems it has some correlation with Bartonella. It's not at the stage where it's painful, and I'd like to keep it from getting to that stage. Any suggestions on what to do about irritation when urinating? So Bartonella is known to be a cause of a condition in the bladder, which is called interstitial cystitis, which is the lining of the bladder can become inflamed and irritated, and that is caused by the Bartonella, right? By extension, the urethra, the tube that connects to the bladder that runs through your penis to the outside, that can become inflamed as well as part of this process too, okay? What seems to be helpful for this is to do 2 things. Number 1, quercetin is an bioflavonoid supplement that has anti-cytokine properties that are really good with bladder and urethral tissues, okay? So they can get the inflammation down. So you do quercetin, 250 milligram pill, 2 pills 3 times a day. And you would combine that with something called glucosamine sulfate. Glucosamine sulfate, many of you may know, is the supplement we give to people that have worn cartilage down in their knees, okay? But what it does here is in the bladder, glucosamine sulfate is turned into a gelatinous coat that covers the lining of your urethra and the bladder, blocking the acidic urine from irritating these inflamed tissues, okay? So it's a barrier in a sense. And so that's glucosamine sulfate, 500 milligrams 3 times a day, okay? Now, that's a Thorne product I would do on that one, and I would do a Thorne product for the quercetin, right? Another option would be, instead of doing those as 2 separate supplements, is to look at a product called Bladder Ease. I believe it's still called Bladder Ease. We'll look at it here in a minute. That has in it glucosamine sulfate, has in it quercetin, and has in it a little bit of arginine as well too. That product would be 4 pills 3 times a day. Okay, so either way, you're taking 4 pills. You're either doing 2 quercetins and 2 glucosamine sulfates 3 times a day, or of this product called Bladder Ease, you're going to take 4 pills 3 times a day. Give it a month or 2 to see if it quiets things down for you. Okay. All right. Let me just do a quick screen share here. Got to make sure I'm telling you the right name. I think it still is called Bladder Ease, but I've got to double check that. Hold on a minute. All right. So this is Marty Ross MD supplements. This is my supplement store where my patients get their supplements, but also you can get your supplements here too. Or you can use this as a resource to figure out what it is that I use when I say quercetin. What's the brand, for instance? Okay. So for this Bladder Ease, I'm just going to type in quercetin, which is one of the ingredients. And there it is. Yeah. So the product still is called Bladder Ease. It used to be called IC Blend. That's what I was trying to remember. Okay. All right. So, yeah, that should do it for you. Okay. All right. Let's see here. Go back here. All right. Good luck to you, Jim. Hello, Patsy. Hi, Dr. Ross. I hope you are well. I am. Thank you. Do you recommend the shingles vaccine for Lyme patients? Why or why not? Thanks for all you do. So Patsy, I'm not sure if you're the same person that asked me this last week. If you are, I hope you, I see you did not pay attention. But if you're not, I answered this last week. So I'll do a quick summary of it again. So for people that are age 50 or over, there is an increasing chance as we get older that we're going to develop reactivation of our herpes, chickenpox virus, which is a herpes virus. And if they get reactivated, they come out and we get these lesions on our skin called shingles. And the problem with shingles when you are older is about 10% or so of the time, I believe, that people are left with chronic unremitting pain afterwards. It doesn't go away, okay? Also, when you get shingles, you get this flu-like syndrome throughout your body. You get knocked down pretty hard. There are a couple different vaccinations out there that are available for people over 50, and I do recommend them. I recommend them if a person has Lyme. I have not found that people that have Lyme have any kind of an abnormal reaction for getting the vaccine. Of the two out there, the one I recommend is the Shingrix vaccine. It is available for people over 50. You get an initial dose, and then 6 months later, you get a second dose. It's what I've had because, yes, I am over 50. Actually, coming up on 60 here pretty soon. But, yeah, I have gotten it, and I just got it recently. I didn't get it right away at 50. But as I look at the science on it, I do think for people in my age group and even 50s and beyond, I do think it's a good idea. In terms of what you can expect when you get it, you will get a cytokine flare when you get it, especially after the first dose. And so you can expect that the vaccine is going to trigger cytokines, just like all vaccines do. That's going to result in fatigue, some brain fog, and some increased body pain that could last up for a few days, maybe up to a week, and then it does go away. Okay? All right. So anyhow, but I haven't seen any people that get reactivation of their Lyme or any problems with it when they get the Shingrix vaccine. So I do recommend it. Okay. All right. Good luck to you, Patsy. Hello, Robert. Let's see. I had started on liposomal cinnamon, clove, and oregano about 5 months ago, and herxing became intolerable after 3 weeks. As recommended, I put the pills aside and tried to work up the pill dosage with oregano oil drops. I started with 1 drop and a teaspoon of olive oil and tried very slowly increasing. 6 drops became the limit my throat and upper digestive tract could tolerate. I went back to the pills and immediately began herxing. After 3 weeks, the herxing was pretty painful, pins and needles, neuropathy, especially in my legs, and especially when trying to sleep. I do feel it working, though, with a clearer head and reduced tinnitus. I stopped the pills for 2 days, herxing diminished, and I can also feel the benefit of my glutathione and ATP 360 regimen. I started back on the oregano pills. My question is, can I pulse dose with 2 weeks on and a few days off, depending on how the herxing goes, and still maintain good progress? It seemed just 20 drops of cryptolepis made me... Robert, I'm not seeing the second part of your question, but let me ask that first part. So what I will do when people have a very hard time with herxes from oregano or from oregano, cinnamon, clove oil capsules is I will go ahead and have them just start with the drops like you're doing, okay, because that's a way of getting really low dose, okay? But you can also do the pills by taking a pill every few days. You don't have to take it every day. I've had people just take it every few days and get benefit doing that. And if you do that, 1 pill every few days, and as the herx starts going down, then you go to 1 pill every other day. And as that herxing passes, then you start doing 1 pill a day, if you can, okay? So you can stretch out the frequency of using the liposomal oregano oil or the liposomal cinnamon clove oregano oil based on what you can tolerate. And I use it that way, okay? All right. So everyone, the oregano, as well as the liposomal cinnamon clove oregano that I'm talking about, these volatile oils have been shown by Johns Hopkins laboratory experiments to be useful at treating growing Lyme and growing Bartonella, as well as the hibernating persister forms of Lyme and the hibernating persister forms of Bartonella. And I do occasionally see some people that really just get some really tremendous herxes on them. Not everyone does. So yeah, find the dose you can tolerate and the frequency you can tolerate. Okay? All right. Good luck to you, Robert. So in terms of, if you're wondering what is this liposomal cinnamon clove oregano oil, the company that makes both of those products that I was just mentioning is called Doctor Inspired Formulations. And I carry two of their products, their liposomal oregano essentials and their liposomal cinnamon clove and oregano essentials. Be aware that the amount of oregano that's in the cinnamon clove oregano is equal to the amount that is in the oregano capsule that they have over here. Okay? All right. Hello, Gary. Let's see. Hi, Dr. Ross. Thank you for taking my question. You're welcome. After I had all my blood work completed at the start of my Lyme diagnosis, results showed that I have a high reverse T3 with a free T3 of 4.6. A high reverse T3 at 41.3 with free T3 at 4.6, free T4 at 16, TSH of 1.65, all in normal ranges. My DHEA also showed very low at 6. Is this a result of my Lyme diagnosis, or could I have had this condition all along, as it is not generally tested? I'm 59 years old. What will be the best way to treat both conditions, and will this be a lifelong treatment going forward, or can it be corrected? Okay, so both of these conditions could have been pre-existing, or they could be caused by Lyme. Either way, and there's no way for me to be able to tell, okay? The way that Lyme interferes with your hormones, whether it's your thyroid or whether it's your DHEA, one way is that these cytokines that get made by the white blood cells work at the level of the hypothalamus pituitary, which is the center of the brain that regulates your hormonal systems, to cause them to incorrectly interpret the environment. And if they're not interpreting correctly the communication chemicals that the brain uses, or the DHEA levels or the thyroid levels, the brain isn't going to send out enough signals to make these. Okay, so that could be what's happening with your DHEA. The reverse T3 indicates a condition which is called peripheral hypothyroidism. And so let me talk about that. So your thyroid gland sits here in the neck, and the brain uses a chemical called TSH to tell the thyroid to make its stuff, okay? And so that's central interpretation of thyroid. So if the brain thinks that you're making enough a T4 and T3, it will make a normal level of TSH like you have, okay? And then your thyroid will make normal levels of T3 and T4, all right? Now, what happens and your thyroid makes about 90% T4 and about 10% T3. All right. The difference there's two major differences between T4 and T3. One is iodine. T4 has 4 pieces of iodine. T3 has 3 pieces of iodine. Okay. But the other major factor is that T4 is not really active in terms of helping your energy or helping your cells work. What does make your cells function and set your metabolic rate in your cells is T3, all right? So what's supposed to happen is all that T4 and T3 go out, they get absorbed into your cells. And in the cells, the T4 is to be converted into intracellular T3. But in fatiguing illnesses, sometimes what happens, like Lyme or chronic fatigue syndrome, the body will try to put itself into hibernation. And the way that it tries to put itself into hibernation is instead of all this T4 becoming T3, the T4 has a choice and it can split and become reverse T3. Okay. So your T4 can either become reverse T3 or it can become regular T3. If the body is trying to hibernate, it's going to cause you to make a lot of reverse T3, which slows down your intracellular metabolism, making you feel tired, okay? Kind of putting you into hibernation, all right? So the high reverse T3 would suggest that you have a form of what's called peripheral hypothyroidism. And for that, even though you have normal blood levels of T3, which would really be measuring how much is coming out of the thyroid gland, not really accurately detecting what's in your cells, okay? But even though you have normal T3 here, that elevated reverse T3 says that probably at the cell level you don't have enough. So the correction is take T3, all right? And T3 is sold, you can either get it compounded or you can get it prescribed as something called Cytomel. I usually start people at 5 micrograms twice a day. That increased amount in your cells will get absorbed, and your blood will get absorbed into your cells and be used, okay? So the brain, knowing that you're getting all this extra T3 in a pill, will interpret that and start telling the thyroid not to make as much T4, so you won't have as much T4 produced either, okay? And that's okay. All right. Good luck to you, Gary. Oh, let's see. Yeah, and then the other thing I would do, I would take for the DHEA being low, what I would do if you're my patient, but you should talk to your own doctor about this, the one that's going to prescribe your Cytomel for you. I would probably start at that level. I would probably start at a 25 milligram pill once a day and then retest in about 2 or 3 weeks, okay? And can these be corrected? Yeah. As you get over Lyme, your peripheral hypothyroidism will start to reverse itself. And also your cytokines will go down, which will allow the brain to more effectively communicate with the adrenal glands to make the right amount of DHEA. Okay? All right. Good luck to you. Hello, Sarah. Hold on here just a minute. All right, let's see. Hi, Dr. Ross. Let's see. Thank you. That's a lot of thank yous. You're welcome. First timer here. New at this whole Lyme thing. Welcome, first timer. How do I know for sure if I have Lyme? I had symptoms of Lyme, went to a kinesiologist who said I muscle test positive for Lyme, went to Quest and had positive Lyme antibody 1.28, but the Western blot came back negative. Burgdorferi test run by a neurologist through Mayo came back negative, so he would not refer me to infectious disease specialist. After running the IGeneX test for Lyme, my LMD says, I'm not sure if you have Lyme because the indices were not strong enough to be considered positive in his experience, let alone by CDC. My lumbar puncture indicates I have MS, but I believe MS is not a disease, but is an acronym and something caused those lesions. My neuro disagrees and wants me on Copaxone. I also just tested positive for Cryptococcus non-neoformans, which was similar neurosymptoms to Lyme. I live in Missouri, but had a tick bite in Wisconsin 1 year prior to the first symptoms. So you're kind of in a tough position. So let me just kind of walk this through with you. So when we diagnose Lyme, there's actually 4 things that we consider, okay? And you look at all 4 of these things, it's like building a puzzle, putting pieces of the puzzle together and seeing in the end when you put the puzzle together, is it Lyme? Okay. So number 1, we look at what your symptoms are. And if you have a lot of symptoms of Lyme, it means there's a possibility. Okay. Number 2, we look at, do you have a risk of getting it? So people that have high risk are people that have a known tick bite that got a bullseye rash, okay? Other people that can be high risk, though, are people that do a lot of outdoor activities in areas where there's a lot of Lyme. So, for instance, the whole East Coast is loaded with Lyme, and the North Midwest states like Wisconsin, Minnesota, and northern Michigan are loaded with Lyme too. All right. So if you've done a lot of outdoor activities in the time you've spent up in Wisconsin, I think you said, I believe you said Wisconsin somewhere here, you have a risk. Okay. All right. Third thing we look at is, do you have any physical exam findings? And yeah, I mean, MS could be Lyme. Lyme could be causing MS. And then the fourth thing we look at is, do you have any supportive testing? All right. Now, it would be interesting for me to see what your actual test result is, and I don't have that option here. Okay, but if your the testing that would have been done, that initial Lyme test that came back at 1.28, is a test called an ELISA test. An ELISA test asks the question, do you have any antibodies that your immune system has ever made to fight any infection that might have been made against Lyme? Okay, it's a could test. Okay, could you have Lyme antibodies in you? And if it comes back positive, then the standard is to do something called a Western blot test to see, do you actually have antibodies that attach to the Lyme germ? Okay. The ELISA test that you had done gives a lot of false positive tests. And just because it was elevated does not prove you have Lyme. The Western blot test that your Mayo doctors did will miss chronic Lyme if you have it about 40% of the time. Okay. Now, your Lyme literate medical doctor probably did either a IGeneX Western blot, or they did another test called an IGeneX immunoblot. The better test these days is the immunoblot. Both tests look to see, are you making antibodies against proteins found in the covering of the germ? But the immunoblot looks to see if you're making antibodies against 8 different kinds of Lyme germs, versus the Western blot looks to see if you're making antibodies against 2 strains of Lyme germs, okay? So first of all, I would make sure you had the best test. And so look and see what your test results are. They should say either Lyme Western blot or Lyme immunoblot. If it was not the immunoblot, you may want to pay to get retested again using the immunoblot, which is actually a better test than the old Western blot that was done by IGeneX, all right? Again, the big reason it's different and better is that it looks to see if you have antibodies against 8 kinds of Lyme germs versus the way that the Western blot is done at IGeneX. They look to see if you have antibodies against 2 strains, okay? All right, then, if you did have the immunoblot done and it's kind of positive but not positive enough to call it positive, what I sometimes will do in situations like that is I will do what's known as an antibiotic challenge. And I will give a person an intracellular antibiotic, antibiotics that get inside of cells and get inside of Lyme to kill them. And I'll have them take it for 1 or 2 months and then come back and repeat the Lyme test again. All right, let me talk about that. So one of the problems that we have in getting a positive antibody, Western blot or immunoblot test in Lyme, is that Lyme can release chemicals that suppress the immune system. And because it does release chemicals that suppress the immune system just has a hard time making the antibodies, okay? Secondly, though, Lyme lives in tissues that have poor blood flow. The reason Lyme lives in tissues with poor blood flow is that oxygen in blood can kill Lyme, all right? And Lyme's a real wizard. Lyme likes to survive, so Lyme quickly gets out of the blood and moves into tissues that have poor blood flow. The immune system does best seeing things in the blood, okay? That's where it's going to have the strongest reaction, all right? So what you do when you give an antibiotic challenge, like I'm suggesting, is it starts to kill germs in your tissues. And tissues don't like to hold on to dead bug parts, Lyme parts, and they release them into the bloodstream where, guess what? Your immune system has an easier chance of seeing it. Okay, so that is what is something is called a provoked test. What I like using for my provoked test is either doxycycline, 100 milligrams twice a day, or I like using clarithromycin, 500 milligrams twice a day. All right. And I'm looking at two things. I'm looking at, number one, when I give the antibiotic, does the person have a reaction? Do they either get worse, suggesting a herxing or a killing reaction, or do they get better? All right, because you can sometimes improve pretty quickly, not usually, but sometimes you can. Okay. The other thing I'm looking at is what does that repeat Lyme immunoblot or Western blot test show me? Does it more reactive after you had the antibiotics? And if it is, that's a clue you could have Lyme too. Okay. All right. So that's kind of the approach I use with my patients in this kind of a situation. Okay. All right. Good luck to you, Sarah. Hello, Mary. Hi, Dr. Ross. Which antibiotic do you believe works best in treating Bartonella aggressively? So there's not a single antibiotic that works aggressively. There are a number of regimens that can be strong. Okay. One of those would be to use something called Rifampin along with azithromycin. An alternative to that could be using the antibiotics called clarithromycin and Rifampin. Okay, those would tend to be some of the strongest regimens. All right, but there are other ones that are pretty close. Let me show you an article where you can look at to get some ideas on that. Okay, but usually you want to make sure you're using at least 2 antibiotics. And the other thing is, after you start, about a month or 2 later, you want to add in the liposomal oregano, cinnamon, clove oil I was talking about earlier, so that you can actually treat the persister or hibernating forms of those germs too. Okay, so let me just do a screen share here because I got a good article on this one too. All right, so take a look at my infection treatment plans here. And look at my article called Kills Bartonella, a Brief Guide. All right. And in here, I have some examples of what I call tier 1 approaches. So rifampin or Rifampin plus azithromycin or clarithromycin. Okay, so I just told you that azithromycin or rifampin, or you could do a clarithromycin and Rifampin. Okay, those are strong. Another option could be an azithromycin with a minocycline. Okay, but all of these are probably equally strong and equally effective up here. Okay, all right. Good luck to you, Mary. Hello, Bill. Hi, Dr. Ross. What are your thoughts on taking Disulfiram and Dapsone at the same time for persister, Lyme, and Bartonella? Thank you. I think it's a real harsh treatment. I think it would be very hard to tolerate. That would be my first take on it. So let's look at this for a minute. So Disulfiram, as many of you know, is the wonder drug that gave a lot of people benefit. I think it helps some. I think it's, in the end, I'm not as thrilled by it for the vast majority of people that I have seen. So Disulfiram, everyone, is the drug we use to treat alcoholism that was discovered a number of years ago to have ability in the laboratory to treat persisting forms of Lyme. Okay, so keep in mind, Lyme has a growth state and has hibernating state. Probably about 10% of these germs can become hibernators, according to lab experiments. And the Disulfiram targets these persisters. What we do not know from lab experiments is, does it do anything for the growing forms? Okay, so the growing forms would be spirochetes and cyst Lyme. You probably have heard those words before. And then there's the hibernators over here. Okay. All right. So we don't know if it does anything for growing. Okay. But also Disulfiram, based upon further studies that were done about a year and a half ago at Johns Hopkins, does not look like it has any activity against Bartonella, all right? But disulfiram is a persister drug, okay? But probably just persister Lyme. Dapsone does have the ability to treat persister Lyme, probably persister Bartonella, maybe persister Bartonella, okay? All right. Can you use them at the same time? Yes. But both of these drugs have huge side effects. I mean, the Dapsone will do a number of things. Number one, Dapsone can leave you feeling just fatigued from being on it. Number two, it interferes with folate metabolism, which can cause you to develop anemia, and it can suppress your bone marrow as well too, okay? Disulfiram does help about 30% of people that take it to get into remission, but that means 70% of people it doesn't help, okay? About 15% of people are going to develop neuropathy problems. About 30% of people are going to develop some form of mental health problems. And it's a terribly fatiguing antibiotic as well too. I mean, so yes, you could do them. You're going to need to couple them with other things to hit the growing Lyme. You're going to need to target them with other things to hit growing phases of Bartonella as well too. But can you put them together? Yeah, I mean, you could give it a try. All right. Good luck to you, Bill. Hello, Margaret Lee. All right. Let's see. Do you advise layering different herbal antimicrobials for Lyme and Bartonella? Currently taking Research Nutritional's BLT and the Byron White ABART. Do you think adding Banderol and Cemento would be useful? Should I remove one of the prior? Okay, so Banderol, everyone, is an herb called Otoba. Cemento is cat's claw. Both of those have some good Petri dish experiments showing that they effectively treat biofilm Lyme as well as cyst and spirochete Lyme. And when you put the two together, there's a whopping kill, okay? In addition, the cat's claw, which is the Cemento, has got some newer research that came out of Johns Hopkins last year that shows it treats persisters, okay? Byron White ABART is a group of herbs that are intended to treat Bartonella. To be honest, I don't find them that useful, okay? All right. And then the Research Nutritional's BLT, let's go look at that one together here. I never quite remember what's in it off the top of my head, so we're going to do a screen share and look at it. Okay, so the Research Nutritional's BLT has in it some red root that can help improve blood flow, especially with Babesia, Smilax, which can improve blood flow, Lamodium, Fardium, Boneset, Teasel, which can treat Lyme. Yeah, so this is, bear with me a minute. You know, this can treat intestinal parasites with blinking of what's in it, and can treat Lyme and Bartonella. I will tell you, even though I carry it here at my store, I have not found it to be that effective when it comes to helping with Bartonella and Lyme. That's just been my experience, okay? Other doctors may have different opinions, and you may want to talk to your other doctors about that, okay? That's been my experience, all right? So if you're trying to treat Lyme and Bartonella, my preferred herbal options to treat Lyme and Bartonella are Otoba and cat's claw, And you don't need to use the expensive nutrimetics to do that. You have lower cost options of companies that make Otova and cat's claw about 1/3 the cost of the ridiculous prices that Nutrimetics charges. I think it's absurd what they charge. Okay, so I'll show you. We carry some things, and recently I got my herbal medicine manufacturer to start producing, or requested, and they were able to acquire it. Otova. We now have Otova. It's a company called Montana Pharmacy. But you can use the Otova and the cat's claw to treat Lyme, and they would even pick up persisters. Okay. And then for the Bartonella side, what I would use is the herbs Sida acuta and Hutania that come to us out of Buhner herbs. And those I have found to work about 70-75% of the time to treat Bartonella. And what I would do with all 4 of those tinctures is I would take them at the same time. They're liquid. And I would start at 5 drops 2 times a day of each and add 1 drop per dose each day till you reach 30 drops twice a day. Take them at the same time, okay? After you're stable on that, then I'm having people actually add liposomal cinnamon, clove, and oregano capsules that I was talking about earlier tonight. And that's to more effectively pick up the persister forms of Lyme and Bartonella, okay? That's my preference. I just haven't found, Byron White I just don't think works at all. And the BLT, I kind of find mixed results out of it. I find better results in my practice here in Seattle, Washington, using Sida acuta, Hutania, and then the Otova and the cat's claw. Okay? All right. So let me just do a quick screen share here for you. All right. So you're doing the... So I have 2 choices for Otova on my site now. Okay, so we've got the Banderol, that is the 2 ounces is $65 almost, and that's what the manufacturer says we're supposed to charge. Okay, there are some people that sell less, but they're not following the manufacturer's recommendations. All right. Anyhow, so that's expensive, $65 for 2 ounces. That's enough for a month. Okay, or you could look at this Otova bark that we just got in. And this is a product by Montana Pharmacy, and it's $25. It's less than half the cost. Okay, all right. So anyhow, take a look at that. That's an option for you as well. Okay. All right. Thanks for the question, Marguerite. Good luck to you. Hello, Laura. Let's see. What adrenal supplements do you recommend in people with tick-borne diseases and very low adrenal hormones? Thank you so much. Background, 25-year-old female with Lyme, Bart Babesia for 11 years, 6 years untreated, 2 years treated by a Lyme letter medical doctor, 2 years of only herbs, liposomal, curcumin, and a Belushi, due to closed U.S. border. Now she's been treated for 2 months by a Lyme letter medical doctor with Mepron, clarithromycin, Bactrim, Florinef, and herbals. Her aldosterone, cortisol, and DHEA were extremely low. Florinef helped POTS greatly, but she's worried because steroids suppress the immune system. We love you. Great. Thanks. I appreciate that. You know what I like using is my foundation support for the adrenals is ashwagandha. Ashwagandha is a Ayurvedic and Chinese medicine herb. It's used in both of those traditions. It's used as something called an adaptogen within both of those systems of medicines, but it's been observed for hundreds of years, thousands of years to give people better energy. All right. If we look at animal models and animal studies about how the herb works, it appears that you get improved thyroid and adrenal gland function. And the adrenals make that aldosterone and cortisol and the DHEA, for instance. Okay. So you get better adrenal and thyroid function in animals when you're on the ashwagandha. All right. So the way that I like using ashwagandha is I like using an organic India product, and it's a 400 milligram capsule. I suggest people take it as 2 pills in the morning and then repeat another 2 pills between 1 and 2 in the afternoon. I usually suggest people don't take it later than 2 because I found it to give sleep disturbance. Okay. All right. I hope that answered your question. You should talk that over with your doctor too to see if they agree with that. But that's generally what I would wind up doing with that. Okay. All right. Good luck to you. Hello, Joyce. Let's see, Dr. Ross. I have chronic 20 plus years of Lyme and Bartonella and have been on antibiotics briefly in 2001 and 2016, but primarily herbs since then. It is impossible to find a decent LMD here in Arizona, but found an excellent functional doctor who has been helping. A few weeks back, she suggested I stop the Bart herbs and continue with Otoba and cat's claw, but on a 4-day on, 3-day off schedule. I'm in week 3. What are your thoughts? If Bart's symptoms were to return, when should I expect something? As always, thank you immensely for doing these webinars. All right. So in terms of Bartonella and stopping treatment, so if you've got Bartonella still in you and it's active and you've been taking herbal or prescription antibiotics to control the germs or kill them, and you stop them too soon and then Bartonella is still there, usually within about 3 to 4 weeks, you're going to start seeing a return of the Bartonella symptoms. Okay. Usually comes back pretty quickly. All right. So that's what I would look for. In 3 to 4 weeks, start seeing if you're starting to get back things like pain on the bottom of your feet, anxiety, depression, tremors, shakes, bad thinking. Those are Bartonella symptoms. All right. Okay. Air hunger sometimes can be part of Bartonella as well too. Okay. In terms of this pulse regimen, let's look at the rationale behind that, and I'll tell you what my experience is. So there was the idea behind pulsing your antibiotics is to deal with persisters. And so what was observed about, I think maybe 7 years ago now, Dr. Kim Lewis and his colleagues at Northeastern University in Boston did some laboratory experiments where they grew Lyme on a petri dish and they used antibiotics. And what they observed is that under continuous use of antibiotics, the germs would move from growing into hibernating states, okay, or persisters. And then when they would stop the antibiotics, they were able to get the germs to wake up and start growing again. And then they would resume the antibiotics. And they found that if they did that 4 times, starting and stopping 4 times, that they could wipe out all of the persisters and all of the growing Lyme. Okay, so that got a lot of us years ago, 5 and 6 years ago, to start thinking about pulsing the antibiotics as a means of dealing with persisters. Generally, my experience is that it doesn't work that well to do the pulsing. Okay, I haven't found major improvements in the majority of people. There is an occasional person that does. Lyme grows extremely slowly. And on those days that you are off, it will not come back sufficiently to cause any problem. On the other hand, I do not like pulsing at all for Bartonella. And the reason is Bartonella replicates every 24 hours. Same thing with Babesia. Babesia replicates about every 24 hours. So anyway, my preference is not pulsing for those. Okay. All right. Thanks for the question. Good luck to you, Joyce. Oh, there's more questions here. Hold on a minute. Oh, no. I think I answered your questions there. All right. Very good. Hello, Nina. Oh, it's been quite a while. So nice to see you're here. I'm sorry you're here. I'm sorry I felt compelled to come back, meaning that probably your health has changed here. So let me read about this, okay? Let's see. Hi, Marty from Nina in Niagara. Wondering what symptoms and timeline would be for reactivated Lyme following immediate Pfizer-Vax reaction, April 21. Canadian specialists diagnose long-haul Vax reaction symptoms of POTS, small fiber neuropathy, autoimmune component, although tests are normal. Tinnitus, hearing loss, headache, head pressure, zombie-like brain, tachycardia, hypotension, pericarditis, internal tremors, fatigue, muscle weakness and wasting, vertigo, dizziness, sensitivity, light and sound frequencies. No known treatment as yet. Any thoughts? So, Nina, this is where it gets to be kind of tough because it is true. There's a rare people that have some vaccine-related injury, and it's rare. But unfortunately, you're one of those rare people, and I'm sorry to hear this for you, actually. Right? But it's also possible that that what you're dealing with is reactivated Lyme, because Lyme can do all the same stuff too. The unfortunate thing is we don't always have the most reliable testing to see if Lyme is active or not. Okay. In these kind of situations, though, what I have started to do is to get either through Armin Labs, which is a German lab, and you can get the test kits in Canada. They are doing them for Canadians. Armin no longer does them for the U.S. The U.S. is not allowing that. So in the United States, you would do this through a lab called Infecto Lab of the Americas. But you want to get through either one of these labs, you want to get their what is known as their ELISpot test. Okay, and what an ELISpot test does is it's a test that measures if your T white blood cells have, in the last 2 months, been trying to attack Lyme. You can even do it for Bartonella too, all right? The trouble with the IGeneX or the ELISpot test, either through Armin or through Infecto Lab, for Bartonella is they're only looking to see if they're testing to see if your T cells have attacked one strain of Bartonella. So if you have other strains of Bartonella, it won't tell us that, okay? So the thing about T cells is T cells live in us for circulating T cells, the kind that are in the bloodstream, will circulate for about 2 months and then they die. So the idea with an ELISpot is we look to see, we take your T white blood cells, put them in a test tube, and then we introduce into the test tube proteins of the germ that we're trying to test you against. And if your T cells react against those proteins, they'll release chemicals called cytokines, and we can measure those cytokines, all right? And so if they release cytokines, it means they've seen those proteins, all right, sometime in the last 2 months. So if it comes back positive, it means you probably got activated Lyme going on or activated Bartonella. If it comes back negative, though, it doesn't exclude having activated Lyme and Bartonella, all right? And this is a situation where if you haven't been treating for Lyme, what I tend to do with my patients, I'll try to get the Infecto Lab or the Armin Labs ELISpot test. But if we've got nothing else and if they show activated Lyme, yeah, I'm gonna treat for Lyme. But sometimes with my patients, I'm actually moving forward with trying to cover them and treat for Lyme in situations like this in case it's reactivated Lyme. Okay. All right. Good luck to you, Nina. I'm sorry to hear this has happened. Hello, Justin. Let's see. Do these infections cause muscle wasting? All right. So the answer is yeah, they can. Number one, when you have, again, as I mentioned tonight, your white blood cells, when they see Lyme, they release cytokines, right? And one of the things that can happen with excess cytokines that get released in this condition is those excess cytokines can cause muscle wasting. All right. So yes, the cytokines can. Okay. Secondly, muscle wasting can sometimes be caused by nerve injury. And Lyme and Bartonella can injure nerves, all right? So what happens with nerves, where your nerves attach to muscles, they release chemicals that help the muscles to maintain muscle mass. And if those connections are injured, or if the nerves aren't working correctly, they're not going to release those chemicals to maintain muscle mass, and you will get muscle mass wasting as well too. So that's another way that Lyme and Bartonella could lead to muscle mass wasting as well too. Okay, all right. Good luck to you, Justin. Hello, Michael. Let's see. Dear Marty, thank you for answering our questions. In your treatment guidelines, you say CoQ10 must not be taken with Maparon. What about other antimalarials? Specifically, can CoQ10 be taken alongside the herbal antimalarial Cryptolepis? Yeah. So CoQ10, the caution on CoQ10 is it interferes with atovaquone. That is the chemical in Maparon. It actually interferes with its activity, okay? But that's not the case with other antimalarials, whether it's a prescription antimalarials or herbal antimalarials. So yes, you can take the coenzyme Q10, okay? All right. Good luck to you. Hello, Teddy. Let's see. I just started alpha lipoic acid 300 milligram once a day for neuropathy. Hold on here a minute. Let me make sure I read that correctly. My eyes. So it's 500 milligram once a day for neuropathy. What, if any, side effects, positive or negative, should I expect? Interesting. I haven't seen anyone have side effects from alpha lipoic acid before. So alpha lipoic acid, everyone, is an antioxidant that is used that supports the production of glutathione. And glutathione is the most powerful antioxidant that's involved in detoxing, okay? And so I usually would have people take it, if I'm going to do it, somewhere at 500 milligrams once a day is good. You might have more benefit doing it twice a day to promote glutathione production, but once a day is good. I haven't seen any negative side effects. The positive effects is as an antioxidant that promotes glutathione. Glutathione leads to better detoxification in your liver. In addition, glutathione and alpha lipoic acid as antioxidants decrease oxidizing agents that tell your white blood cells to make cytokines, okay? So you can get lower cytokines, and if you get lower cytokines, that can lead to improved thinking, improved sleep, decreased body pain, less fatigue, et cetera, okay? So yeah, those would be some things to think about, okay? All right. Thanks for the question. Hello, Lynn. Let's see. Hi, Dr. Ross. I have an isolated positive ANA with negative ENAs. This is being called clinically insignificant, but I'm wondering if Lyme could cause this finding. Let's see. If this happened to your patient, how would you follow up? So anti-nuclear antibodies nuclear means the inside of your cells, the genetic area of your cells, okay? And it means that you're making antibodies against your genetic material. All right. That's not supposed to happen. Okay. So, but it's non-specific. It doesn't tell us why that's happening. And it is something we see in lupus. It is something we sometimes see in various autoimmune illnesses, but we also sometimes see it in Lyme. So if they've done the full workup, including the ENAs that you talked about, and those are negative, I probably would just recognize that it might be coming from Lyme. You might want to start treating your Lyme and then relook at it again in maybe about a year or so to see if you've made any difference there, okay? But beyond that, I wouldn't get too carried away with it. They're very non-specific in terms of determining what the cause is of it, okay? All right. Good luck to you, Lynn. Hold on here a minute, everyone. I'm getting messaged in a way that I need to just take a quick look here for a minute. Okay. That was a non-message. A friend of mine, I think, was trying to write somebody else and said, "When is dinner?" They weren't writing to me, though. Anyhow, all right, let's see here. This is a question from Sharon. Hello, Sharon. Let's see. Anhedonia emotionless. Is there anything to treat the emotional part of the infections? So number one, both Lyme and Bartonella can produce emotional effects, psychiatric effects, psychological effects. Okay. So yeah, treat your germs. All right. Number two, depending on, I would need to know more, but there are psychiatrists that can work with medications that might be able to help you from a psychiatric standpoint here as well too. Okay. But I don't have a specific recommendation for you here. All right. Good luck to you, Sharon. Hello, Mosby. Can any of these herbals be used topical or with DMSO for regional areas? You know, I've never used them that way. I mean, the idea with DMSO is it's supposed to help increase the absorption of whatever you mix it with into the skin. As to whether it helps, I don't know. I wouldn't be opposed to trying it, but I'm not sure if it would work, actually. Yeah. Hello, SK. Let's see. What health issues, endocrine issues could give rise to super dry skin and hair that won't grow? So, the primary thing I would look at would be thyroid function. That would be the main thing. Just briefly from what you've said there, I would have to ask you a lot more questions, but that's where I would start to look, actually. Okay. All right. Good luck to you, SK. Hello, Carter. Anything for lack of long sleep? Only sleep for 4 hours. Yeah, there's a number of herbal medicines that can help get you asleep and then hopefully keep you asleep. Okay, and so one of those is something called L-theanine. L-theanine is a component of green tea. It's not caffeine, no, all right. And it's an amino acid-like substance that in the brain is converted into something called GABA. And if you give more GABA to the GABA receptors in the brain, it can make you sleepy. The dose for sleep would be anywhere from 200 to 600 milligrams at bedtime. All right, that's one option. Another option to consider trying is nighttime THC, not CBD, but THC. CBD, which is a form of medical marijuana, is actually stimulating. THC marijuana is actually something sedating. That's an option. Another option would be to do an herbal compound, something that has a variety of things in it. So things that can induce sleep that you can mix together would be things like valerian, theanine, yams, wild lettuce. Oh gosh, I'm blanking here. We'll look at the product together, okay? And then finally, the other thing you can do is 5-hydroxytryptophan, which is a form of tryptophan. And a sleep-inducing, staying asleep range could be 200 to 400 milligrams at bedtime of 5-HTP. So, for instance, you could do a 5-HTP and the L-theanine. You can do both of those. You can take a number of these and put them together, all right? And I have articles on this. I'm going to show you how to do this. Bear with me here a minute. All right, so for this sleep formula that I was trying to describe to you, there is this sleep formula that is by Karuna, and the main ingredients in here are valerian, lemon balm, hops, and passion flower. It's a nice mix, okay? All right. And then in terms of sleep, I've got a whole chapter on that. Take a look at my sleep section here and read through these. So there's a number of just how do you set up your environment? What are things you should do to make it so you have a better chance of getting sleep? Okay, take a look at that one. In terms of the natural medicines, you can take a look at this article And in here, I talk about the 5-hydroxytryptophan, the L-theanine, and I talk about the herbal combination product I was just telling you about. And I also talk about the medical marijuana. Okay. All right. Thanks, Carter. Good luck to you. Hello, Thomas. Let's see. Do these infections cause salt wasting? Do we need to supplement calcium with the magnesium? I haven't seen for the majority of people that these infections lead to salt wasting. Okay. That just hasn't been one thing that I've seen. And generally, I don't mix my calcium magnesium. I just do magnesium straight. Okay. All right. Good luck to you, Thomas. Let's see. Hi, TJ. Did FMT, did fecal microbiota transplant ever provide benefit for folks when you were treated them in the past? Okay, so a stool transplant, everyone. So the fecal microbiota transplants are allowed by the Food and Drug Administration for one condition only these days, okay? It used to be that you could get it for other reasons, but now they only allow and regulate it for one purpose, and that's to treat a type of bacterial infection in your intestines called Clostridium difficile. And so the ways you can do it, you can either take capsules of freeze-dried stool, or you can do enemas of stool. And basically, the bacteria that are in these stools will repopulate your intestines with healthy bacteria. All right. Now, I have had benefit when we were allowed to do this for other conditions, for treating people that had just developed severe dysbiosis or imbalance of good bacteria in their gut after using rounds of antibiotics. When we couldn't get anything else to get their guts to work correctly. So I've had people that would get normalized gut function from doing that. I have wondered if replacing people at the end of treatment with healthy stool would also help improve their immune system's ability to keep the germs under control after treatment. But we haven't been allowed to do that. All right. So, yeah. All right. Thanks for the question, TJ. Hello, Brandy. Suggestions to gain weight. Okay. So some things I would think about with people that are having weight loss problems is, number one, I would want to look at the thyroid to make sure you don't have too much thyroid. Too much thyroid can lead to weight loss, okay? Number two, I would want to look at the medications you're on and see if there are any that lead to weight loss. So for instance, it's very common on Mepron, also known as atovaquone, to have weight loss. It kills the appetite, basically, okay? Number three, I would want to know more about why you're not eating. Why are you having an issue getting food in? Are there issues filling up easily? Are you constipated? I would want to get more of a bowel history, eating history, so I can figure out if there's something intestinally that we should be fixing, okay? And then number four, if I find that it's not an intestinal issue, that you seem to be having good absorption of your nutrients, there's no oil floating in the toilet suggesting you're not absorbing your food, thyroid looks normal. The other thing I would wind up doing is trying to pack more calories in. And your food source that is the most calorie dense is our fatty foods. So those could be things like eating more avocado, could be having a tablespoon 3 times a day of flaxseed oil, or having a lot more nuts or nut butters. Foods that are fatty put weight on fastest, okay? All right. Good luck to you, Brandy. All right, everyone. That's it for me for tonight. I'm actually, I know I'm going to cut out here about 5 minutes early, but I'm starting to get a little hypoglycemic. Normally, I would have had a chance to go get a quick bite before the webinar, but I had a day that ran way too long. So I've got to go take care of myself here. I'm going to pay attention tomorrow morning to your email. Somewhere around 9:30 in the morning, you will get an email from me indicating that the recording is ready. When you get that email, you'll also have a chance to sign up for next week's webinar. Next week will be the last webinar we do this month. Keep in mind that I'm trying to reach as many people as I can, and I would like to recruit you to help me. So if you find these beneficial, forward that email to other people. When you get requests from me to sign up for these webinars, forward those emails to other people. Help me to reach as many people as possible, okay? I'd appreciate that. And I wish everyone a good evening, and I look forward to seeing you next week. Good night, everyone.